Hello, my name is Tomas Moran and I'm from Integrus Health Group, and I'm here to talk to you today about the proposed scoring structure for the value-based payment program of the Community Mental Health Fund for the year 2023. There's 18 of you of the agencies that have worked through at least 1 year of training. Some of you have gone through a couple of years of training and will be ready to participate in this program, which kicks off in March, as you'll hear in a moment. 8 other agencies that might watch this video are in their training year, and they will be able to participate in a similar program that will be launched for the 2024 year. So what we're going to do now is walk you through a slide that describes the proposed rules and scoring methodology. These are going to the board at the end of the month of February. So the rules that are shown here and the rubrics are part of a packet that will be a formal set of scoring rules for the 2023 version. If you have any comments, suggestions, or questions, please direct them to staff via Taryn Lichty at this email. And the final rules, when they're published and approved by the board, will be communicated to you in an email with a link to the final rules. Let's start with some basic definitions. All of you have been working with us. In fact, all of you have been working through a series of 3 sessions and completed 2 of them. In the first one, we created some goals. And the second one, we talked about indicators might be useful for those goals. And in the third one, if some of you have already seen this, we begin to talk about the tasks. These are the building blocks that will help us with those KPIs to actually do the processes of improvement. Our liaisons describe this in a game analogy, and many of you have heard this. If key performance indicators could be your pieces, and the tasks are the cards that tell you how you move around the board. There's a rules book that talks about the complexity of how we scored these tasks and the formulas that are going to translate that into dollars at the end of the year to assure fairness. But really, most of the understanding of it can be had just at the level of the key performance indicators and tasks, which we're covering in this session. Some of you have already worked on a dashboard. You're going to be having a maximum of 12 KPIs in your dashboard that you're going to be using to play with. Think of it as 12 players in your roster of a team. There's some substitutions that will be allowed, but generally you're going to be working with those rosters. And we encourage you to work in the areas of access, outcomes, patient satisfaction, and staff satisfaction. But there's also some of you working in transitions of care and so forth. The indicators, as you see here in this sample of what somebody might be measuring, you can see some indicators here. You'll be receiving in your packet in March a list of many, many indicators that are sampled from all of your agencies and that you can use for ideas in your own agency if you're still at a loss for some of the KPIs that you want to play with. And then the second player here is the tasks. These are the things that are going to tell us what we do to earn these incentive points. Some of the tasks are simple. Some are basically declaring your players, who is the starting lineup of your KPIs, that kind of stuff. Others involve analysis, such as looking at your KPI into the past to help you set baselines and goals. And other actions are harder, which are the involving of actually doing rapid cycle to do improvement in some of those goals. And you will earn some incentive points for completing each of those tasks. Let's look at a simple task, a very simple task of a beginner level, a fairly easy task is to establish a minimal set of KPIs. What does that mean? It means that you tell us 1 or 2 KPIs that you're using to explore one particular goal, one particular aspect of your services. You have those KPIs approved by your liaison into your list, and you report 2 consecutive quarters of that KPI. So that constitutes completing it. This card can be played, and the star that you see here indicates a level of points you'll see that we will translate those into actual points by the time that the rules are finalized. But this would be earned kind of on the lower number. Here's how somebody might need it. They might measure an indicator in the access domain called new non-residential clinics and clients. And they've shown us that they've reported it for 2 consecutive quarters. This data is from 2022, of course, 2 consecutive quarters. And they've established a KPI so they can play that card and earn the points in that card. You will be able to report any task that you have completed at 3 points during the year: June 30th, September 30th, and November 30th. And you will basically file this by any time in the prior couple of weeks, emailing Taryn and your liaison with the list of tasks that you have completed for that. And the liaisons and Taryn will be available during the month of March after our rules are approved to help you devise a reasonable set of tasks that you imagine that you might try to get done by each of those dates. So let's look a little bit about those tasks. We divide them into a rubric of complexity and a rubric of difficulty. And one of the analogies that Susan Jones, one of our liaisons, uses for this, which I find very useful, is imagine that you have a jigsaw puzzle, and a beginner jigsaw puzzle might be something very colorful, a banana and an apple on the picture that is very easy to distinguish on a blue background, and you can do it very easily. Whereas an advanced might look at a entire sea of sunflowers, which is going to be quite difficult. An intermediate might have a picket fence, a house, and a dog or something. And then within those easy beginner type of puzzle that has an apple and a banana, you might have a 10-piece version that's meant for somebody that's just starting with jigsaws. And then there's a medium of 100 pieces. And then there's a hard one that has 1,000 pieces. It's still the banana and the apple, but it's a hard puzzle. And you can see that a hard puzzle of the advanced category would earn you that many more incentive points. So we've calibrated these tasks, pre-calibrated them so that you'll see they're already pre-assigned the value. Let's look at another example of a task. This is a slightly harder task, similar to the period one, just declaring your players, showing that you can calculate them in 2 quarters. But here we're asking you to have 3 or more KPIs associated with that goal. And what we're trying to encourage is that we know that to address a goal, there's a main KPI that you're going to be paying attention to. You can call them the leading actor or actress in that play. But there's a series of supporting casts that will kind of nod their heads and say, yeah, that this is what's happening, and we're making the process work without damaging other things. So for example, an entity might measure access and making sure that people can see a therapist sooner after beginning making their initial contact. But another KPI that might be important is to watch a total number of new cases that we get to see each month to make sure that we don't break one item while we're fixing another. So making a robust set is a more complicated task, and you earn up a little bit more in terms of incentive points. Here's what somebody might file at the time that they file the completion of that task. They tell us here's a 3 outcome, in this case, KPIs that we're measuring, and here's the value, and we measured them for 2 quarters. So there we go, we completed this task. There are going to be many, many tasks. These are going to be that are available. You don't have to play them all. In fact, I'll talk later about the goal of focusing on 1 or 2 goals, as we've told you throughout this process. But there are tasks that have to do with reporting. We talked about these establishment tasks, going backwards and reporting 4 quarters in the past, looking retrospectively at your data, analyzing that data and using that data to select an appropriate baseline and a goal for your items. Those are tasks. And when you complete that step, you earn some points for that. And then when you complete minimal improvement, moderate improvement, and robust improvement that are defined in the tasks themselves, moving all of the distance to the goal to get to robust, or a little bit toward the goal to get to minimal. And then tasks that show that you can sustain that gain over time. Those are increasingly more difficult tasks and they earn more points. Let's look at a sample of a likely progression of tasks that you might do in pursuit of one goal. This is just one of your goals. You ask the question, what KPIs will help us see progress in this goal? And you establish a set of KPIs for that, and you earn some incentive points for that. Then you look retrospectively maybe, and you look back a year and you analyze and you establish a baseline for where you've been going and a reasonable goal. How much can we aim to improve? And again, those are the analytic tasks that will earn you a little bit more, but basically on the low side of numbers. And then here come the improvement tasks. At some point, you might show that you have carried out some quality improvement. If you actually seen some movement to the goal, and lastly, that you are sustaining that over consecutive quarters to show that you're still paying attention to it. This is a likely series of steps. So the entity would be able to play some of these early cards at the early quarters, and then some of these cards in the late quarters. This process is going to roll into next year. So at some point, the beginning of the year doesn't matter much anymore. You may have projects moving throughout the entire year. Timeline for reporting. So some tasks, of course, we're going to try to incentivize you to, aside from picking the difficulty level of your task, you learn a little bit more points for completing that task sooner than if you wait and you complete it later. There's a complicated rubric with numbers that are not final, but just to show you that a beginner task of a medium difficulty might earn 20 points. And then that'll be discounted if that task is done by November 30th instead of by June 30th. For improvement tasks where you set a goal and then you try to move toward that goal, these are discounted by the number of quarters following the establishment of the goal that you start. Again, these numbers are not final, but at some point, these cards that you see will have the stars, but they'll also have specific number of points here as to how you score that particular task. By the time that you receive the packet, you'll receive a full deck of these task cards. Each one of them will have a very short description, just to remind you what that task entails, and it'll reference you to the rules book where we'll have the full help of exactly any details that you need to know for completing that task. And of course, Taryn and the liaisons are available in any of these areas to clarify for you. So let's see what would happen at the quarterly reporting periods, June 30th, September 30th, and November 30th. You file a document like this. It says, I think I created a robust set. How did I achieve it? Well, here's the 3 KPIs that I'm playing, and I reported them for these 2 quarters. So you earn 20 points for that. And again, these numbers have not been finalized. I also provided backdate. I went backwards in time and reported 4 quarters in 2022. So I get some points from that as well. And then I established a baseline and I established a goal using that and studying that. So these 4 tasks or activities that you carried out help you move the pegs along the board, and you earn 60 points for that quarter. At the end of the year, we'll total up the submissions that you've made. Maybe the second quarter, your staff was busy, you were doing other things, or maybe you had turnover and you needed to replace some of the players. And then in November, maybe you came back and did some more tasks. We total them up, and then that gets converted into the dollars, incentive dollars. Remember that in the training years, you've been doing tasks to complete an incentive up to 8% of your allocation. The final numbers will be approved in March, but the numbers that we're looking for the 2023 range from 8 to as high as 25% of the allocation. Those numbers will be final and will be paid in 2024 based on these totals. You might be wondering, how much do I have to do in order to earn the incentive, we're aiming the midpoint of what we expect folks to be at and gaining at taking two goals, as we told you, so like 2 to 3 goals, 2 goals that you focus on, and you carry the steps for those goals, and you do moderately well. That should be plenty to earn you at the median point that we expect. So next steps, final scoring rules expected at the end of this month. By early March, you will receive a packet that will include some of our ideas for KPIs. I told you about that before, so that you can get ideas from other agencies, from our own list of KPIs if you're interested. The list of all the tasks that will be available, that deck of cards, pre-scored for complexity and difficulty, and a PDF document that will be the fine print of the rules in detail. You will be asked then to complete your playing roster by March 31st, and to think during that time how those KPIs might play with the tasks. If you want help, or if you want us to review with you, we would love to meet with you in the month of March after all the rules are final, and suggest for your agency what a reasonable set of steps that you might take to earn your incentive for 2023. Thank you.